really does lead me to the topic that I want to discuss with you today, how we build a culture of health in America. And by that I mean shifting the values and actions in this country so that health really does become a part of everything we do. So much so that we don't even think about it. Now, why do that? Well, as you know, health is the bedrock of personal fulfillment. It's the backbone of prosperity. It's what helps our nation stay strong and competitive and compassionate. It's what allows our kids to grow up knowing that they will really experience all of life's opportunities. It's what lets our businesses know that they can rely on the vitality of their workers to achieve the goals that they want to achieve. And it's what lets our military perform at the highest levels. So that's why at the Robert Wood Johnson Foundation, we've made building a culture of health the central aim of everything we do. It's the theme of this series, and so I know that it's part of what you intend to do here at Penn as well. And we believe that if we can come together in forums like this, these kinds of seminars all around the country, and begin to think about how we can comprehensively build a culture of health, we can probably do it in a generation's time. And when we do, our country will have a very powerful story to tell. It'll be a story about how we came to see that health is much more than simply not being sick. And it'll be a story about how we recognized that health is a vital aspect of how and where we work, how and where we live, how we make decisions for our children, how we make decisions about our families. And it'll be a story about how we rejected as inevitable that our kids, a third of whom are overweight or obese right now, are going to be the first generation of kids to live sicker and die younger than their parents. It'll be a story about how we overcame the dismal fact that just this year, a group of retired military leaders told Congress that in 2014, a shocking 75% of young adults are either too fat, too poorly educated, or too tangled up in criminal nonsense to serve in the military. It'll be a powerful story about how our nation that currently spends $2.7 trillion on healthcare and still loses $227 billion a year due to loss in productivity. Building a culture of health is an idea that will require us to stretch our current understanding of health in ways that we've never done before. It's a view that will force us to respect America's diversity in how we view health, our backgrounds, our different ethnic backgrounds, and also will recognize the right for everyone, even if they have different perspectives, to have an opportunity for health. So, what does a culture of health look like? Well, I think it surely looks like the World Health definition of health. And I think if we imagine living in a society where promoting health is just as important as treating disease, and where everyone has access to high quality care when, where, and how they need it, and where physicians sharing medical notes with their patients and then having frank conversations about price and value of treatments in a way that lets patients get well, but also save money. I want you also to picture towns and cities and neighborhoods where the health of all children is a matter of fact, not a matter of chance. And knowing that our employers and our mayors and our educators and our families are working together to give everyone the opportunity to make responsible choices on their own behalf and in service of their own health. Now, it's a bold idea. We understand that. But it's one that I believe is possible. Now, I'm looking out at you and I'm seeing the same look that I usually see when I talk to people about this. People thinking, you know, it's a pretty rosy picture, Risa, and you know, you're somewhere between ill-informed or just naive. A bubble over the head a lot of times is, that's, you know, a nice fairy tale, but you know, how are we going to get there? Don't you understand the harsh realities? And I very much understand the harsh realities, that there are too many Americans who are coping with avoidable chronic disease, that heart disease, cancer, stroke, those things still kill 50% of, they still account for 50% of the deaths in this country, and that sadly, where you live so much affects your health that your zip code at birth may just be as important as your genetic code in predicting how well and how long you will live. So let me give you a couple of examples of that. This is the DC Metro map, and the red line there shows that if you live up in Bethesda, Chevy Chase, you're going to live about 84 years. And if you were born in downtown DC, you're going to live less, about 7 years less. If you look in New Orleans, it's even more shocking. If you are born and live up there in Lakeview, you're going to live about 25 years longer than if you live in Iberville, which is just about 6 miles away. And when it comes to our youngest children, research tells us that learning and development begins from birth and is critical through the first 3 years. And yet kids don't go to school, public school, until they're 5. And for far too many of our kids, we know that adverse experiences, things like extreme poverty, drug abuse, family violence, are a part of their lives and can lead to this chain of events that leads to poor outcomes in health and often early death. We're also painfully aware that under our current healthcare system, the quality, cost, and experience of their care is frankly disparate and often just dismissive. I know many of you know the work of Jeff Brenner and the hot spotting that he's done over in Camden, where he's shown that 1% of the population, what he refers to as super utilizers, account for 30% of the costs in Camden. And these are expenses that he's shown can be prevented by coordination of care and by, frankly, just prevention. So I am painfully aware of these harsh realities and that they are not a hallmark of a culture of health. But my hope is that we're going to stop going down that path and go down a different path, one that we can create together as we put our heads together and understand how we can address all of these challenges and others. Now, in order to do this, we have to undergo a fundamental change in our understanding of what constitutes moving towards health in this country. We have to experience a kind of light bulb moment, each of us, tap into that light bulb moment, where we shine a beam of recognition on how these different and very complex aspects of health come together and actually quite interconnected and impact health. So I want to share with you my light bulb moment. You've heard from Jennifer that I went to Harvard and I trained at the Brigham and Women's Hospital, and while I was there I rotated through a hospital in West Roxbury. And that's where I met a patient who I will always remember, and I refer to her as Patient Ruth. Now, she appeared at the admitted station one cold winter night. She was homeless and helpless, came in with swollen feet, leg ulcers that obviously made it very painful for her to walk. Her medical chart was thick because she had been to the hospital many, many times before. And so we did what we always did. We gave her a warm bed, some antibiotics, a couple of decent meals. But then the next morning she had to go because the rules said our job was done. And so she limped back out into that tunnel of problems that she came in with. No home, lousy food, no network of friends or family to help her. Our care ended at the front door of the hospital. And that was so very short-sighted because I asked myself, what if instead of ushering her out the door, we had asked ourselves, what did it take to prevent her from coming back to the hospital? And then what if we had connected her to the people and services that she needed to stay out of the hospital? In fact, why can't connecting people to the people and services they need to stay out of the hospital be the central aim of every single encounter that we have with patients? Now that was my light bulb moment. And believe me, once you explore these light bulb moments and you get that recognition of the interconnectedness, you see it everywhere you look. So let's think about a few. Think about our workplace or academic culture that demands that we sit way too long. And what if we made the automatic things that we do just a little bit harder so that we could park in an even more remote parking lot? I know many of you probably think you park in the most remote parking lot possible, but you know, a little more remote one. And then what if you walked to your office or class instead of taking the shuttle? And what if we routinely held walking or standing meetings? I know Penn has a walking club. I've been told that it meets every Friday about noontime, and has a power walk, a 3-mile power walk once a week. But why not have that every day? You know, I have some colleagues that have a peripatetic book journal club where they walk as they discuss the articles in the books. I was really heartened that, you know, even in these divisive times, Republicans and Democratic members of Congress are coming together to walk around the Capitol, wearing their Fitbits and various things and tracking their progress. I hope the fact that they're walking in circles isn't, you know, a further statement of what's going on, but at least they're walking together. And then contrast that to the neighborhoods where mothers don't dare let their kids outside to play or to walk to school. Well, why can't we create walking school buses like they did in Kingston, New York, where kids walk to school in a group supervised by adults and then have an increase over time in their physical activity that's been documented. You know, the first description that I had of a walking school bus was actually at a clinical scholars meeting, and now they are taking off all around the country. And what about the healthcare providers who know that they should be asking about their patients' lives outside of the office, but then they just don't know how to connect with community services? In 2001, there was a survey that showed that 85% of physicians recognize that their unmet social needs of their patients actually do impact their health. And yet, 4 out of 5 physicians say that they have no clue how to connect those social needs to their patients. So when the light bulb goes off, we begin to see how deeply intertwined all of these forces are and understand the prophetic role they play in actually improving the health of our nation. Now there's an African proverb that teaches the wise aim beyond the present. So let me voice RWJF's idea right now. We believe that as a nation, we can strive together to create a culture of health where everyone in our diverse society is able to have healthy lives now and in the future. And the truth is that even though we are the nation's largest philanthropy that focuses only on health, we don't make policy and we don't deliver any health services. We don't make anything. We don't sell anything. The only power that we have is to invest in you, in your innovations, your scholarship, your commitment, your ability to create new knowledge, and then to promote that into action. And that's what it's going to take to build a culture of health. It's not going to be me standing up here, but it's going to be you and others studying the solutions, disseminating those findings, and then really cranking up the volume on a nationwide call for change. So at RWJF, we're focusing on a few key issues that we think are really critical to trying to achieve this goal. So let me tell you a little bit about them. 7 years ago, we committed $500 million to reversing the epidemic of childhood obesity. And the good news is that we're starting to see signs of progress. Nationally, that relentless rise is starting to level off. And when it comes to our youngest children, we're starting to see a drop in those, a fall in the ages from 2 to 5. But the progress is fragile. And so we're going to keep on this area and renew our efforts and redouble our efforts in childhood obesity. We also want to make sure that everyone who's eligible for coverage gets it. And not only do they get it, but they understand how to use their benefits. Now, I love this slide because it shows that because of the Affordable Care Act, we've actually seen a decrease in the number of uninsured by about 8 million between September and June. And now it looks like that number is settling out around 7.5, which beats the expectations that CBO had, which is fantastic. But there's still 1 in 10 adults who are uninsured. That's about 28 million people. And we aren't going to have a culture of health unless we have people covered. So we're going to continue to work on that. We want to reduce the, reduce the kind of wasteful spending that we see inside and outside of medical offices, and make sure that America gets the highest value for the healthcare dollars that they spend. Now, I was really encouraged by a study that I'm sure many of you saw in Health Affairs last month, where WellPoint did an experiment where they asked some of their enrollees who had insurance if they would go to an MRI site that wasn't their own, but was cheaper. So they had the choice of going to one that was their usual provider or one that was cheaper. And 15% chose to go to the less expensive provider, which tells us that there are people who will choose value even when they don't have to. And so we're interested in understanding how we can promote that kind of a shift in the way we think of getting our health care and our responsibility towards our health care. So we also want to do a few other things. We want to promote and spotlight the healthy places and practices all around the country that are demonstrating that we can actually get to a culture of health. We know that early childhood trauma, as I mentioned earlier, is related to violence and to many other adverse outcomes. And so we want to identify and evaluate the solutions that address that. And finally, health equity is something that we know we are not going to achieve a culture of health unless we can reduce the disparities that we have in this country. Our focus is going to be on the solutions that need to be promoted if we're going to achieve greater equity. Now, another area that I didn't put on this slide because it's not as directly relevant to this audience is a real focus on bringing businesses into the conversation and helping business understand the role that they can play in helping communities become healthier. So let me just stop for a moment and tell you some of the convictions of the foundation that have led us to these key issues. All of what's happened over the last few years and the weight of the studies has taught us that we're never going to be a healthy nation if we continue to be a violent one. And so the foundation has taken the long view that we need to look at the long-term ramifications of trauma and the factors that can lead to violence at an early age. The adverse child experiences that create the kind of toxic stress that can lead to violence, but also many other health outcomes, is the long view that many others aren't taking, and we think that the foundation can take as part of this new initiative. We believe that a society can never achieve a true culture of health as long as 1 in 5 Americans face barriers to achieving health that are greater than others. Personal responsibility is key, but when 1 in 5 Americans live in communities that don't have jobs, have poor air quality, have unhealthy food, they have the deck stacked against them, and we want to make sure that we address those kinds of systemic problems. All of this adds up to creating a seismic shift in the way we think about health and making it happen from the ground up. So that's why identifying the places and policies around the country where people are already committing to a culture of health and demonstrating effect becomes critical. Because only by exploring those can we change our expectations as a nation and help to recalibrate our behaviors as individuals. Now, why do I think a shift of this magnitude is possible? Well, in part because it's happened before. And every time it's happened, it started with an idea. Think back to 1970. And I know some of you weren't even born in 1970, but when Earth Day started, recycling was not a part of our vocabulary, much less a part of our regular behavior. But we began to ask the question, why are we choking our landfills and our oceans with plastic and paper and things that we can recycle and repurpose? And then we began to insist on change. And now it's instinctive to recycle. And part of the reason is because we've made it easy. There are recycling bins on every sidewalk, in every household, in every store, offices, and most of us feel guilty if we accidentally, throw a bottle or a can in there with the coffee grounds. I do, I did it yesterday, reached down in, pulled it out, took it over to the other one. I mean, it's a part of our culture now. And similarly, there was a time when there was no single number to call when someone was injured. And even if they got to the hospital, no one knew that they were coming there. The doctors and nurses didn't know they were coming. They hadn't gotten any first aid. And as a result, the death rates were shockingly high. But then there was the idea to have a single number and the connection between the frontline emergency technicians and the hospitals. A very simple idea, but a revolutionary change. And now every child in America knows to dial 911 as soon as they get infatuated with that cell phone, right? My little granddaughter can text it. So let's make shifting to health our next big idea, so that one day people will actually look back at our current state of health and the way we have things organized and say, is it true it was like that? Just the way our kids express disbelief that people used to smoke in hospitals. I mean, it seems absolutely implausible to us at this point. Now, in history, it's rare to recognize a moment of great change when it's happening. But we're all very much aware that we're on the threshold of a lot of change. We have big data. We have the quantified self. Everyone is collecting information about themselves on bands and new watches and linking that up in ways that we never imagined before. We have personalized medicine, and we have social entrepreneurship that is changing things at lightning speed. So I really do believe it is very much like the famous science fiction writer William Gibson said, the future is here. It's just not everywhere. What we have to do is distribute it. And that, I think, is that it's not everywhere, but it is here, is true of a culture of health too. Because in a growing number of communities all around the country, people who are about ideas going to action are coming together and demonstrating what's possible. So let me introduce you to a few social entrepreneurs that are doing that. This is Rebecca Ani. She established a program called Health Leads that allows providers to write prescriptions for things like food or heat or social connections, and then college students fill those prescriptions. Last year, Kaiser Permanente adopted this as a model. And there's Rev Michael Minor, who lives in Hernando, Mississippi, and has a congregation there. And he decided that he was going to ban fried chicken at the church dinners. Now, I hear the snickers, because many of you know that fried chicken in a Southern church is a tradition, and it has been for generations. But he was tired of seeing his flock die prematurely of preventable diseases. So now they have healthy potluck dinners after church, but more importantly, they have a track around the church. They have blood pressure monitoring in the lobby, and Reverend Minor has developed a curriculum to spread this health ministry to other churches, and it's been adopted by the American Heart Association. Now, neither of these social entrepreneurs had millions of dollars at their disposal when they started, and they didn't have any extraordinary political clout. What they did have was a question of the status quo, an idea for changing it, and then the conviction to convince others to work with them in changing it too. Now, I've told you we want to try to get business to invest in making the nation healthier. And of course, the business world is all about the bottom line. So what do we know about the return on investment of health promotion? We know from a Health Affairs article that the ROI for workplace health promotion programs, if you look just at the medical expenses, is $3.27. And if you look at absenteeism, it's another $2.73. Now, earlier this year, people right here from Penn, Zeke Emanuel and Kevin Volpe, were working with a commission called the Vitality Commission to come together with industry and academia and researchers and ask, what can business do to promote a culture of health? And one of their top recommendations was to have the corporate sector report their health metrics the same way they report sustainability and financial metrics. Now, 2 days ago, I was speaking to the group of the industry group that represents sports and fitness, and I challenged them to be the first industry to report this in their corporate filings and to do it across the board this year. What about education, another social determinant? This is data from the University of Chicago and the University of College of London, and it looks at 3 of the most successful programs for early childhood intervention and what the return would be for at-risk children in this country. And it determined that the benefit for kids under 5 would be $254 billion for boys and $154 billion for girls. Now, that figure includes employment, productivity, and also reductions that we would see in the tax bill if people didn't have as much encounters with the criminal justice system. Now, the state of Oklahoma took these data to heart because they asked themselves, why were their kids having to live under the shadow of statistics in their state that showed that if kids didn't get these kinds of early interventions, that they were 25% more likely to drop out of school, 40% more likely to become a teen parent, and 70% more likely to have some kind of an encounter with the criminal justice system. And so the state decided to put universal pre-K into practice. They provide schooling beginning at age 3 years old for everyone in the state. The program is so popular that both Republicans and Democrats routinely voted in, and this is one of the most tax conservative states in the nation. So to me, this shows how powerful ideas backed by data can actually unite people across the aisle. The point is that a culture of health is not going to be cultivated in any single way. Different communities are going to have to build cultures of health that make sense for them, and that makes sense. This year, we established a prize. Actually, it was last year we established a national prize to highlight communities that have placed a priority on the health of their citizens. These are places where ordinary citizens, like us, come together and form partnerships with business, with government, and community organizations, and make a deep commitment to improve the health of their citizens and to stick with it until they actually see change. Now, these places are very diverse economically and geographically, but they all come together to produce a meaningful health outcome. So let me show you a quick video about one of these inspiring communities.
Williamson, West Virginia, a coal mine practically smells. The mines brought prosperity to the town for generations, but as demand for coal declined, so did the health and well-being of Williamson. Community leaders like Dr. Dino Beckett were determined to turn things around.
We're very tied to the history of coal, and we're very proud of that heritage. It's just with less opportunity with coal, we have to discover other opportunities that we can still raise our families here and have that ability to live here. We lead the state of West Virginia in categories such as obesity, hypertension, diabetes, and that's where we want to make the impact and move the needle in the opposite direction. We want to empower our residents as far as exercising, eating quality foods, learning how to garden, learning how to become entrepreneurs. One key element of Sustainable Williamson has been the community garden. It is located next to lower income housing and gives residents in the area an opportunity to come out and employ their skills as gardeners and entrepreneurs potentially. One of the biggest challenges that Williamson has is access to foods that are healthy. We've been able to work with the community and identify those and make it available through a mobile farmers market or the farmers market in Williamson. We identified more and more patients that were losing their insurance, that were unemployed, or that just couldn't afford to go to the doctor's office. The need was so big that we decided, hey, what about opening up a clinic that would be able to service all of these people that they can't afford those quality health care. So in doing so, we had the concept of starting Williamson Health and Wellness, a nonprofit clinic. The task at hand for the community was there were all these problems such as obesity, diabetes, and heart disease. We didn't have a lot of resources. So we were able to identify several groups in the community that were working on various things, and we were able to kind of pull those together under the blanket Institute of Williamson Health and Wellness Center. When you have that sense of camaraderie that people experience here when they work in the coal mines, they rely on each other when it comes to safety and well-being. So everyone has the urgency and the need to look out for their neighbor, their family member, to help them through hard times, and then also to enjoy the good times.
You know, in Williamson, it was the health center that galvanized the community. In Brownsville, it was the university. In Spokane, Washington, it was the Chamber of Commerce that drove the catalyst. The point is, these folks are the kind of people that give me the belief that we can and will do this. It's going to be hard, there's no question about it. But what we're going to have to do is turn the small victories into national successes. And along the way, spotlight those things that work, study them, as the academic community can do, and then learn from those that aren't working. I have no delusions that it's going to be easy. In fact, it's going to be very hard. But I believe that if we put purpose with passion, we can in fact raise the health to the level that this great nation deserves. Thank you.